Hi guys, this is just an explanation about your case study 2 assessment task. Just going to download it here. You'll find it under case study assessments, and this is just me talking through it. So I'll scroll up. We've just put in looks like a case study just to make it a little bit more exciting. And this will help you answer the wellness section as well. So this is a little bit of person about Eru. He's male, he's Maori, he's 77, a little bit of information about him and why he's in hospital. He's in hospital because of a UTI, but he also has existing conditions such as chronic renal failure and diabetes type 2. But you won't be going back to this case study until you need to answer the health and well-being of Eru. Now he's been admitted to hospital for 3 days, including the Tawhari Tapu Bar. Wicked. Okay, so this is just an overall of what the assessment instructions, what you're going to be answering. And we have just given you some recommended headings that we'd like you to follow so you don't go off track. So separating the systems, they don't knock on effect. We're just going to take them out. A UTI is a urinary tract infection that affects the urinary system. So on one A4 piece of paper, you're going to describe what that main body system is. So you're going to describe the urinary system, and you're going to describe how it should work normally and the structures and the functions. And if a UTI is present, what's going wrong in that system and where. So you might want to pick a type of UTI like cystitis or pyelonephritis or vaginitis, and then you can explain specifically what's going wrong and in which part of the urinary tract infection. Signs and symptoms of that condition, that disease, and explain how the changes in the condition can be measured, monitored, and what would be expected to occur. So knowing what symptoms is wrong with that condition, you'll know how to monitor the change of those symptoms. So it would be do with the pain levels, the fever, the urination, the colour, the smell. There's all your symptoms. Now, how do you know if it's getting worse or how do you know if it's getting better? What are you looking for? All right. So if the treatment is unsuccessful, what would you expect to occur and what would you do as a healthcare assistant? So if they was on day 2, day 3, and he still has blood in his urine and he's still in a lot of pain and the fever is increased, what would you do as a healthcare assistant? So of course you're going to be telling the RN, but what are you documenting to take back to the RN? What questions are you asking your client? And what can you do for that short time while you're getting the RN and the doctor to come and see them? Cool. So you do that for every system. So chronic kidney failure affects the kidneys, the renal system. You talk about the kidney mainly, all right, not the whole urinary system. Talk about how the kidney functions and the structures like the nephron in detail, mainly going from your workbook and the Moodle presentations. Signs and symptoms of specific kidney diseases and stages. How do you know if the condition's getting better? How are you monitoring that over what sort of time frame? And what observations are you using? How do you know if the treatment's not working and the person's getting worse? Great. And the same again with diabetes. So with diabetes, though, just do a brief overview of the digestive system. Okay, just a brief one. Mainly, you're talking about the pancreas, which is an accessory organ to the digestive system. So talk about the structures of the digestive system and then where the pancreas sits and where the pancreatic enzymes actually go into the digestive system at the duodenum. So you're going to talk about that and how the pancreas functions normally. And then when diabetes type 2 is present, what's going wrong? What's that insulin not doing, so to speak? Signs and symptoms with someone with diabetes. How are the changes in the condition? Again, how do you measure and monitor someone with diabetes? How would you know if they're getting better? Or question number 4, what happens if the treatment's not working? And this treatment doesn't have to be a medication or a pill. It could be, like you say, diet and observations as well. And if it's not working, what do you do as a healthcare assistant to manage them? to keep them well. Right, this one's quite a big one. So you know a lot about wellness now. The whole course is about wellness. We want you to use a holistic model. The Tafari Tapu Faa is the one I'd like you to use because the guy is Maori. I want you to tell me who the Tafari Tapu Faa, who created it, how is it created, what does it mean, and now how does this being hospitalized, how is this put the model in place and how it's affected Iru's health and well-being while he's in hospital for those 2-3 days. So just breaking down the walls, each wall a positive and a negative, and what you are assisting him in those 4 walls of the Tafari Tapu Faa. I've also got a link up on Moodle about the Tafari Tapu Faa and Mason Jury. Right, I hope this helps. Remember to call or to text. Look at the rubric. So to get a really good understanding, comprehensive describes structure and functions of normal and then abnormal when this disease is present, and then how the changes in the condition, just exactly the wordings we got on the heading. Here then the ranges of why the current measures are abnormal and what are you going to basically do about it. There are 15 points here though for the Tafari Tapu Faa and the impact of him being in hospital on his well-being. Hope this helps. Let's get out of here. All the best. Stop.